So this is your high yield practice question. And like I said, just write down your answers, even though the answers are there, just to know how many you are able to answer. So under hypertension management, you have a question: a 50-year-old patient with hypertension has been taking hydrochlorothiazide 25 mg daily for 4 weeks. Blood pressure remain elevated. So this type of question, that is your evaluate. If you follow what I said, the exam is broken down into assess, diagnosis, plan, and evaluate. So this type of question is evaluate, because the reason is evaluate is that patient has hypertension, so a diagnosis is already made. It's not a diagnosis question. Patient is on hydrochlorothiazide 25 mg. So this is a plan. A plan has already been made. Okay. But the problem now is that this blood pressure remains elevated. So what is the most appropriate next plan to take? Will you wait for another 4 weeks? Will you increase the hydrochlorothiazide to 50 mg? It's already 25 mg. Or will you add a drug from another class, or will you stop the medication and switch the class? So if you remember, if you choose the answer C, you are correct, because I know somebody will say let's increase it to 50 mg. But remember, this patient has been on this for 4 weeks and it remains elevated. It remains elevated. And if you remember that when you are managing hypertension, we say that thiazide, thiazide, it can only reduce the blood pressure by zero point 0.10. Even though the value is not, the blood pressure range is not given in this question, but this is just for teaching purposes and just for more emphasis. Okay, so if you remember what I said, thiazide is used, it reduces the blood pressure by zero point 0.10. So let's say that somebody's blood pressure is 180 over 120. The most thiazide can do is to reduce it to 170 over 110. Okay, it reduces it at most 0.10. So you will see that this patient will still not meet the guideline. The guideline, like I said, the rest of the group, like younger people, somebody with chronic kidney disease, somebody with diabetes, according to JNC8, it has to be less than 140 over 90. Okay, except an elderly patient that is healthy, it will be less than 150 over 90. So this, you see that monotherapy is not working for this patient. So we say that the first line treatment is usually what? Hydrochlorothiazide, calcium channel blocker if they are African American. So when you put them on hydrochlorothiazide and patient is still not doing well, and the blood pressure goal is so, even if you keep elevating it, what you are doing is to put the patient on more risk. And don't forget that hydrochlorothiazide can also cause erectile dysfunction, higher doses like 50. So that is why increasing it is not the best choice. What you can do is to add another medication. If they are African American, if they are African American, you can add calcium channel blocker. If they are white, Caucasian, you can do ACs and ARBs. Okay, we can add it. So first line of treatment is not just thiazide. First line of treatment can also include thiazide, calcium channel blocker, ACs and ARBs. Please always remember that. Then we have another question here. A 67-year-old male with a history of hyperlipidemia and hypertension asks how often he should have his lipids checked. So, how often should you check lipids? Is it annually? Is it every 3 years? Is it every other year? Is it every 5 years? So, I think this one is straightforward, is annually. Okay, but sometimes it depends on the condition. Some in practice, the patient can come in depending on the value. It can be rechecked every 3 months, every 6 months, then every yearly. It all depends on the range of the patient. Okay, but if everything is normal or everything is going well, annually is fine. So this is another question. A hypertensive patient reports a severe allergic reaction to sulfur. Patient is allergic to sulfur antibiotics. Patient complain skin sloughing and hospitalization. So which medication should be avoided? So another thing to remember here, medications that causes sulfur allergy. Please always remember that. List of medication that causes sulfur allergy, because you don't know the one you'll be asked in the exam. So those list of medication that causes sulfur allergy, please remember that. Hydrochlorothiazide is there, Bactrim is there. So and I know I have a video on that. Please, medication that causes um, sulfur allergy. So the hydrochlorothiazide is one of the medications that is high yield in the exam. So please don't forget that. A hypertensive patient reports a severe allergic reaction to a sulfur antibiotics. Patient has skin sloughing and hospitalization. Which medication should be avoided? Hydrochlorothiazide. So next question. Which of the following medication is contraindicated in pregnancy? So what medication is contraindicated in pregnancy? Labectol, labectalol, meltildopa, ACEs inhibitor, insulin. Which of the following medication is contraindicated in pregnancy? Labectalol, meltildopa, ACEs inhibitor, insulin. If you choose AC inhibitor, you are correct. Okay. A patient with atrial fibrillation is started on warfarin. Which lab should be monitored regularly? So I believe this one is very simple. When somebody is on warfarin, which lab should be monitored? INR, PTT, platelet count, and DIMA. So which one should you monitor when somebody is on warfarin? The answer is INR, International Normalized Ratio. A 62-year-old male with hypertension presents for routine follow-up. His blood pressure has been well controlled until recently. He reports taking naproxen daily for joint pain. Which medication may be contributing to his elevated blood pressure? I let you read it. So, which medication is worsening blood pressure? That is the question. Which of these medication do you think is worsening blood pressure? Is it lovastatin, naproxen, inhaled fluticasone, which is a steroid, or is it amoxicillin? So, what medication worsens blood pressure? What medication worsens blood pressures? Another way they can ask you this question is, what over the counter medication worsens heart failure? What over the counter medication worsens heart failure? What over the counter medication worsens blood pressure? The answer is naproxen. So naproxen, like we know, is an NSAID. Is an NSAID.
Okay. Good. Mhm.
A 30-year-old woman presents with butterfly-shaped rash. So if you really know the answer, even before I read the options, you should know your answer. Patient presents with butterfly-shaped rash on her face, joint pain and fatigue. What is the most likely diagnosis? Butterfly rash, that is the buzzword. Patient presents with butterfly rash on the face. So is the answer is lupus, systemic lupus erythematosus. Okay, that is very important. So please remember that. Psoriasis, dermatomyositis, rheumatoid arthritis. The answer is systemic lupus erythematosus. So that is your lupus. Please, that is the buzzword mala rash. Another question they can ask you under SLE, systemic lupus erythematosus. It can be which people or who is at risk. The person that is at risk is women of childbearing age. Please remember that. Women of childbearing age. Okay. And secondly, which group of people? African American and Hispanic. A 60-year-old woman presents with fatigue and exertional dyspnea. On exam, she has a systolic murmur, best heard at the apex and radiating to the axilla. We already talked about this. So the without reading the options, which murmur radiates to the axilla? Is it the aortic stenosis, mitral regurgitation, tricuspid regurgitation, and mitral stenosis? The answer is what? Mitral regurgitation. If you remember the mnemonics, Mr. Pass, MVP, Mr. Pass, MVP. So please don't forget the ones Mr. Pass, MVP, Mr. Pass, mitral regurgitation. Anything mitral, it's located at the fifth intercostal space, also known as the apex of the heart, point of maximum intensity. You can call it any of these things. Point of maximum intensity, apex of the heart, fifth intercostal space. A 50-year-old woman with a history of rheumatic fever presents with dyspnea and autopnea. On auscultation, a diastolic murmur A diastolic murmur is heard at the apex. A diastolic murmur is heard at the apex. What is the most likely diagnosis? So remember our diastolic murmur. The mnemonic is Miss always right. MSAR. Miss always right. MS, which is mitral stenosis. Then AR. Miss always right. Miss always right. So Miss is mitral stenosis and AR is aortic regurgitation. So somebody will say, why not A? The answer is not A because they said at the apex. So it is talking about mitra. Mitra is found at the apex. But if they said, remember R in the middle, if they said right intercostal space, right intercostal space, that will be aortic regurgitation. So you must know your positioning of this murmur. Anything mitral, even if it is aortic, even if it is a diastolic or systolic murmur, anything mitral is going to be on the fifth intercostal space, point of maximum intensity, and apex of the heart. Anything aortic, even if it's aortic stenosis, aortic regurgitation, even if it's stenosis or diastolic murmur or systolic murmur, they are all going to be right steno border. Always use the R in the middle to remember right, right, because pulmonic is left. Okay, please, these little things is very important for the exam. Okay, we just covered this. A 65-year-old man presents with leg pain while walking that resolves with rest. Pain while walking, it resolves with rest. But the problem is that patient ankle breaker index ABI is 0.6. So what is the most likely diagnosis? Is this deep vein thrombosis? Is this peripheral artery disease? Is this sciatica? Or is this chronic venous insufficiency? So if you choose peripheral artery disease, you are correct. Remember what we covered about peripheral vascular artery disease? We said that their pulse will be weak or diminished. Their skin will be cool to touch. Patient present with hairless, shiny, intermittent claudication. And intermittent claudication, they have this pain when they are walking. Um, and if the patient have the pain when they are walking and they feel better, okay, when they rest, but they can also have the rest pain. So the first stage is asymptomatic, the second stage is intermittent claudication, the third stage is the rest pain. Even if they are rested, they're having that pain. And the last stage is when it becomes gangrene. Okay. A 70-year-old woman with heart failure presents with worsening dyspnea, 3 point pitting edema, BMP is elevated. Which medication is most appropriate for symptomatic relief? So if you look at this question, I purposely put a question like this because this question has some components. First of all, remember the symptom of heart failure is always a question you can have in the exam. The symptom of heart failure, which is the pitting edema, the S3 crackle, right? Heart sound, Then patient will present with BMP. Anytime you see the BMP in the lab, that is heart problem. It is elevated. So your question can be, what lab is elevated? That is BMP. Then what is the treatment for this? We have these four: ACEs inhibitor, beta blocker, loop diuretics, and calcium channel blocker. Sometimes you might see another option here, thiazide diuretics. So that will help me to, for emphasis, the difference between loop diuretics and thiazide diuretics. Both of them are diuretics, loop diuretics and thiazide. Thiazide is used for more something that is less severe. But anytime patient have something that is worse, you use loop diuretics, because loop diuretics does more, will help more in reducing the edema. So the edema is 3.3 plus. So please remember that 3 plus. A 58-year-old man with hypertension is started on lisinopril. 1 week later, the lab shows potassium is 5.8. So what is this telling you already? Patient started on lisinopril and patient potassium is already increased in 1 week. So what is the most likely diagnosis, or what is the most likely cause? Okay, is this renal failure, dehydration, hemolysis? ACEs inhibitor induced hyperkalemia. So of course this is hyperkalemia. Remember we said that one of the cause, or one of the side effects of lisinopril, of ACEs and ARBs, is that it increases the potassium. Hyperkalemia. A 30-year-old woman presents with chest pain that worsens when lying down and improves when sitting forward. The ECG shows diffuse ST elevation. What is the most likely diagnosis? Patient presents with chest pain that worsens when lying down and it improves when sitting forward. ECG shows diffuse ST elevation. What is the most likely diagnosis? So is this STEMI? Is this pulmonary embolism? Is this pericarditis? Is this GARD? The answer is pericarditis. If you remember our teaching on pericarditis, patients will tell you that they feel better when they are leaning forward. Pericarditis. A 65-year-old man with diabetes and hypertension presents for lipid screening. His LDL is 160. 160. So this question now, what is the recommended next step? What is the plan? This person have hypertension and have hypertension and diabetes, and patient LDL, which is the worst, the bad cholesterol. So what do you recommend? Do you recommend lifestyle modification only? Repeat the panel in 6 months. Start them on statin and refer to cardiologists. So this is simple. The answer is you have to start them on statins. Remember, because the LDL is 160. We say that we don't want it to be greater than 100. And we also say that this patient have diabetes and hypertension. So this patient is really at risk for cardiovascular accident or stroke. So it's important that you start them on statins. A 60-year-old man presents with leg swelling visible varicosities. He reports aching and heaviness in his leg that worsen with prolonged standing. So, what diagnosis do you think? You can write down your answer. Patient presents with leg swelling, visible varicosities. Patient have a symptom of achiness and heaviness. It's very heavy. So, what is the most likely diagnosis you are looking at? If you choose chronic venous insufficiency, you are correct. We already went through that. Chronic venous insufficiency. A 45-year-old man presents with chest discomfort that occurs after meal and during stress. He has a normal ECG and troponin. So patient have a normal ECG. What is the next thing you do for this patient? Order stress testing, start aspirin and statins, refer for cardiac catheterization, prescribe nitroglycerin. So this is talking about stable angina. Stable angina. So the answer is what? Order stress test. How do we know that it's stable angina? Patient complain of chest pain, chest discomfort during meal and during stress. So it has to do with activity. Remember types of angina. It has to be do with activity. The next question. A 58-year-old female presents with fatigue, ankle swelling, and shortness of breath when lying flat. She has a history of poorly controlled hypertension. On exam, there is a basilar crackle, two pulse, pitting edema with S3 heart sound. So what is this telling you? Patient have S3 heart sound, S3 gallop, basilar crackles, peripheral edema, elevated jugular vein distension. Is this pulmonary embolism? Is this COPD? Is this congestive heart failure? Is this renal failure? So if you choose congestive heart failure, you are correct. And under congestive heart failure, please remember that we have two types, left-sided, right-sided. And we also have the classification under New York classification and under American Heart Association. So please let me know what is your answer.